Public gains access to drug database, so it's a public website. Citizens can now check whether medication is legally approved in Trinidad and Tobago following the launch of the Ministry of Health's Regulated Medicines and Substances Portal, an online database listing more than 10,000 registered drugs. The platform allows members of the public, pharmacists, importers, and other stakeholders to search for approved medicines and substances and view details such as registered drug name, manufacturer, and regulatory category. Categories include antibiotics, narcotics, controlled substances, third scheduled drugs, veterinary products, and non-prescription medicines. So here's the problem I have with like Express and Guardian. They don't put a link to anything, and I don't know why they don't put hyperlinks in their articles. Like if there is a drug database, then you can view the drug database by clicking here. It's kind of straightforward, but I don't know why they just don't do that. Is there any reason why I don't put links in no, every other website does have links. Yeah. Anyhow, I have to go and search for it for myself. Here is the said drug database. Tell me what you think. Drug search database.
Sorry. Okay.
First of all, it's mobile up. That's how I'm gonna take up the third. You see in the top there? iGov is iGov TT. Yeah.
Yeah.
So iGov TT. It's mobile optimized. You can clearly see it's a WordPress website because you could see the what's called that thing? Yeah, the crumbs. And then there's a search portal, right? So I searched for Panadol and got 53 results. How much versions of Panadol are there?
A lot. There are a lot of versions of Panadol.
Panadol Advance, Panadol Joint Prolonged Release, Panadol Ultra, Panadol Strength Panadol, Baby Panadol Solution, Children Panadol.
These are drugs that only within our local market.
I don't know if they will just be the approved drugs. They have one that made in Costa Rica, next one made in Ireland, and next one made in
Search for
Panama.
children's Motrin.
Children's Motrin. I don't know if that'll work out or not. Let me see. Searching registry. Nothing.
Yeah, I don't get that here.
Nice. Look for Adderall.
Let me look for Motrin alone and see if Motrin will come up.
Yeah,
children's Motrin cold oral suspension original berry flavor.
So why didn't searching children's Motrin come out? Maybe you're
totally correct. Maybe after putting capitals, if that happened, that's children's, right? That's correct, right?
Yeah.
That's what correct? Yeah.
Yeah.
Children's Motrin. Nothing.
Take off the apostrophe S. Take off the apostrophe S.
Oh, because in the database they probably wouldn't have the
Yeah, but
nope, nothing still, no.
Take off the S and capitalize the M.
Children Motrin. Alright. This is not how I planned this to go. Look, yeah, find it.
Yeah.
Okay, why would that happen?
Why is it case and common C and common M?
Common C, common M. This is like a test plan. This is what you do when you have to test a database. Yeah, common C and common M working.
So is the apostrophe S started?
Okay. Let's see if I put children. Children will just show,
a lot.
Yeah, children show anything with children. Okay.
But yeah, no apostrophe S.
What you say to look for, Michaela?
Adderall.
ADEROL?
No, I think it's ADDERAL, some so.
Adder, okay. Right. I've never used Adderall
I think
in my
it's
life.
I think it's
one
L, two L's.
Nothing.
That's
Anxiety?
ADHD. No, that was ADHD.
Oh.
Adderall. I saw Adderall. ADD.
Well then.
Right. ADDERALL. So double L.
I think they should take into consideration pause spelling too. Adderall didn't come up.
Well, yes, it's not sold in Trinidad. Concerta is.
Spell Concerta?
No.
That's it?
CONCERTA. So replace the S with a C.
All right, for those of you that are listening, we're trying to search for different things in the database to see how the database responds to our searches. And so far, we realized that apostrophe S for children was working.
Nice. So it says nice. Concerta is also for ADHD, so it's a control drug.
Oh, okay. So the database, it responded pretty quickly. Everything that we search for, it will tell you that it's searching a database. It says that it's searching, and then we're like, all right, cool. It worked. This is supposed to help. This is supposed to help pharmacists, and according to the article, which says what is for? Together, we must ensure that the drug database remains an active tool responsive to the evolving needs of our health sector and protective of the trust placed in us by the citizens and our stakeholders. This launch is not just about technology, it's about confidence, transparency, and partnership.
So could you go back on the site and actually click on one of the items? Like if you click on it, more details will come
Not
up?
one thing happens. I don't need to demonstrate that. Not
For
a
real?
thing. Nope.
So
Like,
it just giving it the name of the drug and
yeah, and like when you hover over it, you see it having the blue shadow background, however it is, but you can't click on anything. Not a piece of it is clickable.
scroll up. Scroll up a little bit. Yeah, so
There's a
yeah.
There's
So,
an
like, for
FAQ that has how to
concept,
read
just-
it.
FAQ.
Yeah, on one of the other pages. I think on the home
let me go by
page.
home. Yeah, the homepage has what going on with the homepage?
The homepage under regulated. Let me say the link. And I scroll down all the way. It has how to read it. How to read the drug database. Send it in the
okay.
stream chat.
I went to home and it does okay. It kind of. I went back to the homepage and it didn't respond properly, but okay. Yes, this portal is intended for informational purposes only, and members of the public are strongly advised to consult a qualified notice. Blah blah blah. Key terms explained. Where you see how to search a database. Frequently asked
Let's scroll
questions.
the last one.
How to read the drug database. Oh, okay. Product description, name of manufacturer, and condition of sale. Okay.
That is not a product description. That's just the name of the product. If it was a description, I'd tell you, give you more details.
That is true. That is true. Okay. And it's updated
Like that,
regularly.
that's what I was
to-
thinking of that. Give you like a description of the drug, like.
I guess you had to consult a physician for that, boy.
Or you could Google it.
Probably.
Well, no,
probably.
it's to see. I guess it's to see if it's actually sold in Trinidad, because some pharmacies will tell you not, this isn't sold in Trinidad, and then another pharmacy will be like, yeah, it's sold here.
And then you
So-
will jump on your phone and be like, no, this is sold in Trinidad. But this is telling you that if it's legal in Trinidad, if it's acceptable. If it's approved for use. So if the pharmacy tell you that it's not approved for use, then you could say, no. My government created a website that tells me that it is approved for use. But the FAQs also say, does the inclusion of a drug in a database mean it's approved for importation or sale? Yes. However, for antibiotics, narcotics, and controlled drugs, all regulatory requirements are issued separately by the arms of the Ministry of Health. Well, that's good for them. I guess the database working. They have the FAQs, it laid out nice, and some of the issues that we normally have at the websites that we always see, Akeem, which is like no certificate and those sort of things. We didn't bounce that up here, and that's good.
Because it new. Because it new.
Yeah.
Right?
I mean, talking
Very-
about that, the website you was looking at before we come on.
The sex offenders registry, right? Okay, what's the URL for it? Because I just Googled it and it sent me to our Facebook page.
That's not.
Put it in the stream chat, and let me see if I can find it, because I don't want to click like Google not even.
Alright, I'll put it in each other.
Yeah, I want to share it, because what we're trying to do is we're trying to show that these websites are nice and cool and they get things done until they decide that the website not important anymore and nobody going to pay attention to it, and you get something
maintain
like this. This is what happens when you don't pay attention. Your connection is not private, so that means it don't have HTTPS. It's not secure.
It does, but the
certificate is expired. Yeah, the certificate most likely expired. The security certificate expired 229 days ago. How long is government in power? That sounds oddly specific. It's almost 365 days.
How much? 239?
229. Yeah. That's basically right after this new government came in power.
Tuesday, the 22nd of July.
All right, yeah. And elections was on April? May?
Yep.
April?
Yep.
Yeah. So, 2 months later, the certificate expired and nobody checked on it because now the website says temporarily offline. The website is currently unavailable. Please check back soon. Try again later. So they used to have this sex offenders website that you should be able to go to and vet if anybody is on that website, whether they're going to be like a driver or they're going to be a coach or sports or whatever it is, or teaching or anything like that. And that's supposed to guide you because most countries, most developed countries, of course, would have that. And that's part of the law because you have the right to know, to look up somebody and see if they're there. And this drug database, it's nice, but will it be there in 4 years? Provided the government doesn't change. If the government does change, do you think it will be there? I don't think so. There will be no reason to maintain this because the value added proposition of this, I think, is less than the sex offenders website. And well, that sex offenders website get shafted. So
here is the condition for this to still be under let's say the government change.
Yeah.
And let's say if this project was a project that the previous government started, then that's how they would probably continue it. Like, if it started.
Yes. Oh, so if it was a spillover from the previous government,
and
almost a year later.
Change.
Doubt it. I don't. If it was a spillover, like things that spilled over from the previous government would have been things like whoa. What technological thing made it over, boy? I feel Anansi.
I feel Anansi, yeah.
Yeah, Anansi would have been on the previous government's radar because it would have taken some time to put that in place, and iGov would have been most likely putting that because AI would have started to boom in while the Red government was in power. And Anansi was just something that they just had to continue with iGov. But the yellow one, I think, what else did they stop? Something else, some other technological thing got the boot, but I cannot remember. All the social media accounts. The social media accounts got nuked and they changed the names to all of them. And all of the old posts, they just delete all. Okay, I don't know if it's all they delete, but they have certain ministries I used to follow. They literally nuked them, changed the name, and just started posting fresh stuff. And that was like, oh, come on, man, come on. Like, oh gosh, you can't take away the previous post. That was information too.
Like, because technically you're supposed to like archive it and but I guess
I don't know what the rules for social media are, but we really know the rules of social media. All right, so my prediction is that this database is not going to be there if the government changes, because there is no need to maintain it, and the other government will say it was a waste of resources. Maybe if it changes. If it does stay up, I guess pharmaceutical companies will have a chance, because I'm not in a medical field where this like applies to me a lot. Like my children don't like have any conditions where they have to be getting certain medicines, and I need to check and make sure and all those kind of things. But I know there are people who are in those positions and this might benefit them. If they will use it, I don't know. Like, for any time you go on the website and you put children's with apostrophe S and you put Panadol, and it don't come up, you'll be like, this website not working because children's Panadol all over the place, which is the first thing that we noticed by mistake. I wasn't planning to do that, but I don't know. You know anybody that will, like, it will matter to?
Nah, not really.
I can't see anybody, but as a grown man, there most likely are people out there that I would have bounced up that have the need to pay attention to the drugs that are available for their children. So that's cool.
But like in most cases, people will just go with what the doctor prescribed. They're not going to like go out of the box.
Well, the doctor will prescribe it, and then they will have to go to either the dispensary in the hospital, which should have the drugs for free. Most of the time they don't have it. Then you have to go to a private pharmacy and try to buy it there. And if you don't have insurance, then you have to pay a lot of money to get like the tablets, because some tablets will be like $40 for one and some kind of thing like that. And people usually complain about those things and why the public hospitals don't have the medicine in stock. If you do have insurance, the insurance will cover the price of some of the medication. I did experience that once with a situation, one of my family members, where they were supposed to have the tablets in the hospital for free. And it was a public doctor's prescription. They said, go to the dispensary and give them this. And the dispensary was like, we didn't have that for two years. Best you go and check that pharmacy up the road, and they will give you the name of the pharmacy. You go by that pharmacy, and the pharmacy will say, no, we don't have this, or we don't have that. And I experienced that once. But I never experienced that is not an approved drug.
Yeah, so like...
Yeah,
now thinking, what's the use case for this? Like,
Well,
like a regular person.
No, not necessarily a regular person, but like, say, doctors, psychiatrists, and whatnot. Because, well, for me, for ADHD, there are various medications you could take. Adderall, I don't think is even sold in Trinidad. Concerta is technically sold, but only by one specific manufacturer. So you have to go specifically by them to get it. So if you can't get by them, there's another version of the same drug that, like, I looked for that version of the drug, and that version of the drug is listed as class 3, but then the other version of the drug is just a controlled substance. And it's like, okay. So it's all kind of bacchanal. You see when you get into the really, really niche medication,
Yeah. I understand what you're saying with the niche medication, because I had a work colleague who had to get niche medication, and they came to me to ask me if I could order it and bring it in. And I was like, bro, that was gonna get confiscated so fast. Yep. I wouldn't even know when it reached Trinidad, because they wouldn't even log it. And they were like, what do you mean? I said, well, medicine is not something you just order just like that. It's not it have like things that are banned. I guess this website would have helped at that point in time when we could have checked and see if it could come in the country or not. And then if the customs take it, we could go on the website and tell them, no, it's allowed. Please release my medicine. Maybe. Okay. Yeah. That sounds like it's workable. But well done on putting up our database. Good stuff. There was a point in time where we did not think this was possible for the government to do. Like, we always used to be like, it's easy to just create a database. It's literally SQL, MySQL, and a plugin on WordPress. And you could like link the two, like WordPress itself is a database. And so that's good to know. Good to know that we are there. Good to know that we are there.
That apostrophe thing is probably them trying to be secure. What is call it?
Injection.
SQL.
SQL injection. Yeah.
But there are ways to allow it.
Now with our WordPress plugin, the WordPress plugin is really gonna try to get big set of security. If you like you're coding the database for yourself, then you could put in all that security. If you're putting it in the JavaScript for the database, but with our WordPress plugin. Especially if you're using the free version, then it are no SQL injection mitigation inside there. Michaela will get inside that database so easy and delete everything. No, she'll make Adderall available.
No. That's a different type of illegal. That's a whole different type of illegal. I good.
Hey, all right. Let's talk about contactless payments. Carnival people was tapping to pay a lot, and we find out if Michaela did.